I'm Iona Heath. Until January of last year I worked as a GP in the same practice in an inner city area in North London with a relatively socioeconomically deprived practice for more than 34 years. But I retired in January of last year and I'm now President of the Royal College of General Practitioners. I'm delighted to be coming to the EQUIP conference in Copenhagen in April, where I'm going to be involved in two specific sessions. I'm going to take part in a discussion about the pros and cons of payment for performance, an issue about which I feel extremely strongly because, as many people will be aware, the UK has pioneered payment for performance with the Quality and Outcomes Framework, which has an enormous number of separate indicators which are supposed to indicate quality across different areas of general practice. Now, my argument with it is that it reduces a very complex interaction into a relatively small number of indicators, although there's a very large number. It's a very small number when you consider the complexity of a consultation. And my other worry about it is that it stops doctors thinking. It implies that there's a single right answer in most clinical situations. And I often use the example of a patient of mine who was a lifelong smoker, had a very damaging and traumatic childhood, had mental health problems, a history of dependence on alcohol, a severely disabled child with probably with fetal alcohol syndrome, but who had worked incredibly hard to support this child and now had a cancer of the lung. And the Quality and Outcome Framework for this patient told me that the main indicator of the quality of her care was how well I was controlling her blood pressure, because she also had hypertension. Now, it seemed to me, and probably to her, that her blood pressure was pretty peripheral to her life story and its challenges. So those sorts of things, I look forward to discussing those sorts of issues. And the other session I'm going to be involved with is running a workshop with my friend and colleague Professor Trish Greenhalgh, because we cooperated on writing a paper for the King's Fund about the challenges of trying to measure the quality of a therapeutic relationship in general practice. It's a huge challenge. We looked at many different methods, feeling that we had somehow to respond to the current obsession with measurement that runs throughout healthcare, probably throughout the world. And we looked at the pros and cons of many different methods, but we're looking forward to discussing with the participants in the workshop how they assess the quality, the therapeutic relationship in their work in different countries and health systems across Europe. So, looking forward to the whole thing hugely, and to making new friends and meeting old ones in Copenhagen in April. Thank you.